Thank you, Dr. Neda, for joining me today. We are going to be talking about sleep and eye health. So can you tell us a bit about your background and what you do?
Wonderful. Thank you so much for having me today. I always love contributing to podcasts and education like this because we really need to talk about different aspects of health as it pertains to eye health. I am an optometrist. I've been practicing for almost 20 years now. I started investigating nutrition and functional medicine and how it applies to eye health. I became board certified in nutrition and also for functional medicine through the American Nutrition Association and the Institute for Functional Medicine. Now I see patients clinically a little bit different than I did when I first started practicing, really looking at the whole body health kind of approach. And I also toggle speaking, educating, consulting. So many hats I wear at this point in my career.
I think it's so fascinating that you studied functional medicine and nutrition as it pertains to eye health, because in modern medicine, we're so siloed, right? We've got the eye doctor, we've got a dentist, we've got a doctor for every organ system, yet our organs don't exist in isolation. Everything that we do, our lifestyle, sleep, of course, which we're going to talk about, it all affects every system, including eyes. And I have a personal interest in this topic, selfishly wanting to have you on as well, just for my own education, having a family history of glaucoma and learning more about the impact of sleep on eye health. How did you get interested in eye health?
I was always into the healthcare kind of trajectory. It was dermatology, dentistry, optometry. I just worked my way into optometry. I worked in a lot of sectors of healthcare when I was really young, and I just liked eye health. I thought it was a great way to practice. I loved the way the offices I visited were established, and I just found the eye fascinating. So it was like I was going to healthcare no matter what, and the eye became my project.
You've spoken about the pillars of eye health. Can you explain what they are?
So I think fundamentally how I approach eye health is pretty much the standard of approach for functional medicine. We call it these modifiable risk factors, right? And that stems from nutrition, stress management. Social is very important. The exercise movement node, and the last one, which is just as important as the others, is sleep and relaxation. All of these modifiable risk factors in the pillars of our health affect eyes. The eyes are very sensitive to inflammation, hormone regulation, vascular health. The mitochondrial function of the eye is really important to understand because it's a very fast moving organ. So we have a high cellular turnover in the eye, and you have to think all these nodes of lifestyle affect our cellular capacity, and the eye is not separate from the rest of the body. So everything affects the eye, and sleep is one of the big ones, actually.
Yeah, it's so interesting. Maybe you could explain to our listeners, if they're not familiar with functional medicine, what is functional medicine?
So that's a great question. So functional medicine is really trying to find the root cause of your health problem. So it isolates these nodes that we can attack that are not necessarily your disease state, but things that may be adding to your disease state. So for example, going back to mitochondrial function, do you have difficulty with methylation? Do you have issues processing certain nutrients? Gut function. So we're looking at different areas of the body and processes of how we function cellularly that may or may not be improving or reducing your risk factors for your health concern. And that's really root cause medicine. Learning about functional medicine made me more scientific than even when I was learning in optometry school, because it's fundamentally a evidence-based scientific approach to root cause disease.
That's such a great explanation, because oftentimes people think of functional medicine as just giving people a bunch of supplements. Let's put them on 25 different supplements or do all these expensive tests. And there are people who practice it in that way. And I think that's what gives it a bad reputation. But at its core, it is about what you just described, looking at root causes, looking at things in a more holistic way, trying to understand what are the exacerbating factors and eliminating things that make the problems worse and going back to the fundamentals.
Yes. And also looking at the patient as a person. Modifiable lifestyle changes are not just easily done, right? We have to have a support system. So looking beyond just giving a person a to-do list and really connecting with the patient for helping them navigate those modifiable risk factors.
How does poor sleep impact eye health, and what kinds of issues do you see in your practice?
So sleep really impacts oxidative stress, meaning lack of sleep, inadequate sleep, sleep apnea, right? That translates to systemic inflammation, which both really impair certain parts of our ocular function. So we can link sleep dysfunction to increased dry eye disease, glaucoma, as you mentioned in the beginning, retinal conditions, diabetic retinopathy, macular degenerations. There are studies on sleep as risk factors, lack of sleep as risk factors. These eye diseases really correlate a lot to that inflammatory process and the vascular regulation in the eye that we see that gets exacerbated when we don't have good sleep.
Okay, that makes a lot of sense because the vasculature in the eyes are so tiny. And so are there specific types of sleep issues that do tend to exacerbate eye diseases? Are we talking about just sleep deprivation in general or sleep apnea? Yeah, what's known about those specific sleep disorders?
I would say the top of the list is obstructive sleep apnea in terms of highest risk factors. Biggest two connections there are glaucoma and dry eye disease. There's distinct studies linking the two, especially with issues with that translaminar. It's almost like a pressure gradient that we have at the optic nerve when we lie down. So I would say obstructive sleep apnea has some of the most foundational studies about eye disease linked to that. In addition to, I would say, yes, lack of sleep. There is definitely studies on lack of sleep and connections to eye disease, but not as identifiable as obstructive sleep apnea per se. Now, we can go back and also link sleep issues with what else? Eating patterns, right? Poor eating, cardiometabolic disease, obesity, all of those other risk factors that are linked to poor sleep are also linked to eye diseases as a whole, and that's going from the front of the eye to the back of the eye. So we can translate that, but I would say for sure obstructive sleep apnea has a lot of good sound research about linked to eye disease.
It's really helpful too to think about the fact that there's the obstructive sleep apnea piece, but also the other factors that go along with that, including hypertension, cardiovascular disease, metabolic disease, like you mentioned, weight gain, and all of those kinds of things. Again, we're not looking at things in isolation. As an optometrist, when you're working with patients who have glaucoma or other eye diseases, are you routinely sending them for a sleep study, or what's your process with evaluating their sleep?
Going back to foundational questions, right? And sometimes you have to cater to what your patient's already doing, not doing. The first and foremost problem is that we don't actually ask. We have to first talk about sleep. When we know that this is something that a target item that we can improve and improve the oxygen flow to the optic nerve, for example, if a patient has any risk factors for those types of eye diseases, I do a little bit more of a deeper dive. One, sometimes they already know that they have sleep apnea or they have sleep conditions, right? So obviously, it's always a good way to send a report to their sleep specialist and make sure that everything is being done properly to help the patient at the most highest level possible. But the biggest thing is, if I know a patient reports anything about sleep quality, etc., I send them for a sleep study quite frequently. And that is not a typical referral for a lot of eye doctors, meaning a referral out. I think it should be a standard. I think once we have certain risk factors on a patient's incoming form alongside some diagnostic tests that we find that are risk factors for retinal disease or, as I said, optic nerve disease, even dry eye in a lot of cases, that next step is not a typical step. And I definitely send a lot of my patients for sleep studies. And I find it remarkable sometimes where they think they're sleeping fine and they're not. At the base level, I at least discuss sleep if this is something that they're not interested in. Translates to sometimes just telling to perhaps buy an Oura ring. We also have to start thinking about ways to help our patients navigate maybe health improvement with technology, right? So that is also something that I recommend if a sleep study and going in more in an advanced type of protocol is not something that they're ready for. You also have to understand, and even nutrition background, you almost have to meet where a patient is too. Sometimes if you throw too much at somebody, you get the opposite effect. So there's a balancing act in terms of how much you refer out. But I do think it's quite remarkable how many doctors do not refer out, even with high-risk glaucoma patients, that it's a disservice at this point. We know, we have the data, we have the studies. It's now getting it to the patient.
I'm so glad that you are referring your patients out for sleep studies. I have a very strong family history of glaucoma, and my doctors have been watching my eye pressures for years, my optometrist and ophthalmologist. No one ever asked me about my sleep, nor did they suggest getting a sleep study. Now, me as a sleep doctor, I knew the link, so I went and got myself a sleep study. So advocating for yourself, if you're listening to this and you personally have a history of eye disease or a family history of it, get your sleep evaluated. Talk to your doctor about it. See if you're appropriate for a sleep study, if they can refer you, because there's such a big link between sleep health, sleep apnea. Could you explain a little bit more about the link between sleep health and dry eye? What is the connection there? So as clinicians, what should we be thinking about when it comes to that link between sleep and dry eye? As you can see, there's a lot to learn when it comes to clinical sleep medicine, and we're just scratching the surface in today's interview. If you are a physician or a health practitioner who wants to learn more about clinical sleep medicine in a practical way that you can use in your everyday clinical work, then get my free sleep mini course. I'll put the link to that in the video description below. You can also get it at intrabalance.com/doctors.
Dry eyes, we now call dry eye a disease state, actually. We've changed the definition from syndrome to disease. So that's first and foremost. There is sound evidence about how our glands, our lacrimal glands, our epithelial layer of our cornea, our meibomian glands, these are the glands that secrete oil, they have cycling of improvement in terms of secretion, etc., regeneration, etc., while we sleep. So when you have a risk factor of lack of sleep, all of the functions of these small churning glands that are trying to really help the surface of your eye stay moisturized are going against a hill. So sleep deprivation exhibits ocular surface disease and dry eye symptoms. We know that going back to obstructive sleep apnea, some studies report over 50% of these patients complain about dry eye. Whether their eyes are gritty, sandy, tearing for no reason, dry eye does have a vast array of symptoms that the patients might be reporting. But we know hands down that sleep-deprived patients exhibit more tear film instability, ocular surface staining, which is basically showing you that the epithelial layer is not functioning properly, these micro scratches. And also the treatment for sleep apnea. So I've had patients over and over again that have a great CPAP machine, right? And they need it, right? So they're doing what they're supposed to do and they're coming in the opposite. Somebody's treating their sleep apnea, but their dry eye is getting worse. So as an optometrist, when I ask about sleep, obviously I want to know if they already have CPAP therapy, because there's so many CPAP ill-fitting masks that end up really hurting the ocular surface while these patients are sleeping. So it's actually the machine is causing the dry eye versus even the apnea. So we have to be proactive in asking our patients, hey, how's your eyes feeling when you wake up? Because now I might be prescribing other things, which are goggles specific for CPAP therapy, ointments that really help cushion the cornea while they're on their CPAP therapy overnight. So it goes both ways too. So not only am I looking or talking about the signs and symptoms when they have obstructive sleep apnea, but also if they're having the therapy for it, are they okay? Are their eyes feeling okay?
Yeah, that's such an important point, that the disease can contribute to dry eye symptoms, but the treatment can also be an exacerbating factor. So we have to look at all of it. Let's see. We've talked a little bit about sleep apnea, sleep deprivation. What about patients with insomnia, shift work disorder? I see a lot of patients with anxiety as well. Is there a connection with those types of sleep and mental health issues, or even the circadian disruption that we'll talk about with shift work? What's the connection with those types of issues and eye issues? Do you see higher rates of eye disease in those patients?
I'm not sure if there's any dedicated studies specifically on shift work and ocular health in particular. There might be. There's been so many studies. I always say we just have to dig a little deeper. But I know for a fact that with shift work, we have circadian misalignment, right? We have poor blinking patterns typically are seen also with shift workers, because when you're fatigued, you don't blink the same either, which is also a contributor for dry eye. There tends to be also, as you had said, like there's almost like the psychological pointer where people might be more addicted to maybe like screens at night. There's also that component. And going into, I know we haven't talked about screens, but screens can also exacerbate evaporative stress where you don't blink as much. In addition to that, you have ocular surface irritations, which can surface as dry eye. I would say for sure shift work is not the best for ocular health, because we know the patterns of just health in general tend to not be so good with those types of schedules. Going back to the fundamentals of sleep, insomnia is very much linked to dry eye, glaucoma, because again, we're lacking that pattern of regeneration. Even the retina has a regenerative role at night. So when you're not sleeping, you're not getting those stimuli. Lastly, I would say even with, we talk about melatonin and having that go through our system while we're sleeping, and melatonin is not really a sleep hormone. It's also an antioxidant, right? Oh, there's melatonin receptors in the eye that we don't even know what they do. So there's a lot more that can be done, but I would say it's definitely a risk factor. How deep? I'm not sure, but I would say when a patient tells me these things, I'm looking a little bit more acutely for any types of signs and symptoms, especially for dry eye.
Let's talk about screen time, because that is a question I know both of us get all the time. The impacts of screen time on the eye, and then we can talk about blue blockers for sleep and circadian regulation and things like that. When it comes to eye health and screens, most of us are on screens a lot of the time. I'm on Zoom all day seeing patients, or I work, my practice is telehealth, so I'm pretty much on my screens all the time. And so are many of my patients that I work with. So what's the impact of screens on eye health? And then we'll talk about sleep.
So we almost have to look at the eyes, the front of the eye and the back of the eye. Screens emit light, we know, and they emit a specific point in the visible light spectrum, which is this visible blue light section, right? And that is a specific nanometer in our visible light spectrum, roughly in that 400 to 500 nanometer range. That tends to be one of the highest energy of our visible light spectrum. The issue with screens is that it's not like a very powerful light. So we do have this spectrum, but it's not as a whole a powerful light compared to the sun, right? You're getting very low level light. So the data is really not there to really say that when the blue light goes to the back of the eye, it's actively damaging our macula, which is the central part of our vision. It's very important to high level acuity. So that link is not really out there. And I know they've tried in animal models, but they're blasting light at really high level numbers, and that doesn't really extrapolate to humans. So that's the first, I would say, debunk. The second, in the front of the eye, there's a lot of literature that says that blue light really reduces the quality of vision versus, I would say, damaging the eye. And that's because there is a difference. It's not a spectrum it doesn't have a spectrum, right? So we have that really piercing, as we said, that certain high energy visible blue light. And that may make people feel that it's just an uncomfortable visual experience. We have so many things right now that help us regulate light on our screens. So we have these dark modes, right? We have the Flux app that we can use, which I tell my patients all the time, that can reduce that spectrum into that high energy blue light where we may feel less disturbed, right? The hours of indoor blue light compared to your outdoor life is really the big take-home message, okay? kids learn on screens. Adults are constantly on screens. People work on screens. So we have to go in a little bit with a grain of salt here. Instead of trying to limit screen times consistently, why don't we make it more proactive to go be outdoors? So it's almost that instead of don't do this, let's do more of this. That's the approach that I like. I don't know if you were asking me about blue light blockers too.
Let's talk about those.
So that goes hand in hand with this conversation, right? We have had a lot of literature about, is it good? Is it not good? A lot of the data doesn't really formulate a strategic protocol that we need to prescribe blue light glasses in a certain way. I treat my patients as individuals, right? Some patients do feel more comfortable wearing a blue blocker in the evening to reduce ambient blue light that's maybe from their overhead lights, right? Everything has blue light now. It's not just your screen. And if you feel more comfortable about 2-3 hours prior to sleep wearing these blue blockers, go ahead. That is okay to do. Blue blocking glasses as a whole, the ones that have the coating, etc., there's a regulation on this. We could put that label out there. So there's no regulatory centrality of this company that tells you that this is a really blue blocking. And then going back to the nanometers, how much is being blocked? What part of the blue light is being blocked? Is it the whole spectrum? Is it just one part of it? So I am not pro blue light blocking unless the patient, I feel like they need as much support at night as possible. I am more on the side of let's reduce our blue light exposure as much as we can end of day to help regulate stimuli we get, because it's also not just the screens with the light, but it's also what you're doing on that screen that may be making you hyper. But in terms of damage to the eye, I am not on the side of, let's say that we need to wear blue blocking all day because we're constantly damaging our retinal cells. Now, on the flip side of that, we need to eat properly. So why do I say that? We have a natural regulatory process in our macula that helps regulate blue light. And that is via 2 major carotenoids, and that's called lutein and zeaxanthin. So that's your natural blue light filter. Let's start eating properly, and let's start getting enough lutein and zeaxanthin. That's in dark leafy vegetables, the yolk of an egg, bell peppers. Let's start thinking about that way too, versus just wearing a pair of glasses and thinking we're all good. So it's not a very direct response because there is a lot of wishy-washy data out there, but I do want to just say you don't need blue light glasses for everything. Please be proactive in finding out what this company is doing in the manufacturing side of it, because it could be completely clear and there is no blue light filtration on those glasses.
That is so helpful and such a great point about the nutrition piece and our natural blue light filters that we have in the macula. From a sleep perspective, similarly, the data doesn't really support the use of blue light blocking glasses in the evening. The impact of blue light is quite minimal actually on sleep. I think that's one of the biggest myths that has taken hold in pop culture, pop science, that blue light is bad for sleep. And this is not to say that, okay, everyone should be on your screens now at night. No, as Dr. Gioia was just sharing, we need to be mindful of how we're using screens in the evening. The content also has an impact.
Yes.
It's more about bedtime displacement. Instead of going to sleep, we're going to bed. People now might be watching a show or scrolling social media or whatnot. So we need to look at all of the different factors that go into it. When patients ask me if they should use a blue blocker, that's what I tell them. There really isn't a lot of data to support it. But if you find them helpful, great, use them. No harm. But there's lots of other things that we need to be looking at. Because if you're wearing your blue light blockers and then you're like scrolling TikTok, it's not going to help you all that much.
And in all honesty, too, a lot of these screens have the filter modes that help, too. But yes, I agree with you.
I love that you mentioned the nutrition piece. Let's talk about that a little bit more. So when you are working with your patients and they have eye disease, I know you bring in this functional medicine approach. How do you counsel them on nutrition or other things beyond sleep hygiene or eye drops for dry eye? That's the standard part of the conversation. What else do you offer them?
So I'm a little biased because, as I had mentioned in the beginning, I have the other board certification, nutrition. So nutrition is huge in my conversations with my patients. It's one of the foundational pieces of my conversation. So I'm always looking for nutrient status. Not so much deficiency, although now we keep seeing it more and more often, like vitamin D, but insufficiency. I'm always asking about what their general diet looks like. And we don't need to get to specifics, but just a general kind of how many times do you eat fish per week? How many vegetables do you eat per day? The general questions. And then I'll do usually like some basic standard panel of just checking some of their vital nutrient levels. And it's pretty remarkable how many times I find nutrient deficiencies, as I said, like in the vitamin D or omega-3 imbalance, where they have a really bad omega-3 index, which is our pro-inflammatory 6 to our anti-inflammatory 3 ratios, right? We need both, but we need them in balance. So that is one big foundational piece of my workup. And then going into, yes, targeted supplementation. As you had said before, functional medicine does use supplements, but that's not the primary goal. It's really to utilize supplements either to fill in the gaps or to use them therapeutically. Perhaps a patient needs something to help with digestion or things like that, because that is how we get our nutrients, right? Especially if we have some sort of microbiome imbalance, we really need to make sure that the patient's digestive situation is good. So asking those right questions. I always say I'm not afraid to ask about poop in my eye exams. It sounds crazy, but this is what's needed. We need to make it normal to talk about other systemic functions within a subspecialty, but it really isn't because of our whole body. So those are the two big things that I really look at is nutrient status, general diet, gut function. Those are really high on my list. And going back to that first conversation, I've become really tuned into my patient's mental state. Are they happy? Are they struggling? Connecting somehow there, trying to help them find help. Maybe they need a counselor. Maybe there's something that they just need to discuss about their family that they feel comfortable discussing with me. Gaining that trust in order to start implementing some of these guidelines is really imperative too. We really need to look at the patient not just as this to-do list of nutrients. We really need to look at them as this whole being and connect with them emotionally, maybe spiritually. I really find that it makes me feel good and it makes the patient feel good. So that's the few things that I always try to touch with my patients. I shifted my model 10 years ago to this model and I'll never look back. I worked in high volume practices and this gives me purpose. I always say I'm selfish the way I practice because it makes me feel good at the end of the day, that I'm doing what good for the patient, not just in this, as I said, algorithm of checks and balances, but also connecting with them. And that's healthcare, right? We say we got to bring the care back to health. And it doesn't matter what you do, whether you're looking in the eyes, dealing with other parts of the body, that connection is really profound.
It absolutely is. Thank you for sharing that. If you're a clinician and you're feeling burned out in your job, this isn't really the topic of today's video. We're talking about sleep. And I think this is such an important thing that if you are burned out, there are options. There are other ways that you can practice. And Dr. Gioia here is a prime example of that. Okay, so back to sleep and eye health. What are one or two things that you wish every clinician or patient knew or that they should do to take care of their sleep and their vision?
All clinicians, doctors that are dealing with certain eye diseases, as we had discussed, some of the top being glaucoma, macular degeneration, dry eye disease, I would say ask about sleep. Just ask about how the patient sleeps. Start there. If you can just ask that one question and utilize a local clinic, there's tons of them out there, that's a huge step. You may have taken one of those modifiable risk factors and really improved it for that patient's outcome, right? Number two, for patients, if you have sleep issues, you're already going to a sleep clinic, you have a CPAP machine, guess what? You should be getting your eyes checked. Glaucoma has no visual symptoms until it's too late. Even dry eye, patients don't even have to complain so much. We can reduce those risks of dry eye conversion by just using lubricating drops or whatnot. So I would say patients who already know that they have sleep complications should really get their eyes checked routinely to see if there's any risk factors for eye disease.
Such a great tip. And I haven't seen a lot of collaboration between sleep clinics and eye clinics, but it makes perfect sense. That should happen. Where are you located, and are you collaborating with sleep clinics?
Yes, I have one town over. I'm in New Jersey, in Shrewsbury, New Jersey. We have a bunch in a town over called Red Bank, and it's great. But the sleep clinics, some patients don't want to go that far. They don't want to get that deep. It's at least giving them the option, right? Showing them the way. Everyone should know about their local sleep clinics and perhaps meet with the clinicians. This collaborative piece, especially going back to the cells that mitigate sleep, right? Our retinal ganglion cells, right, are specific for melatonin release. There's an eye to sleep connection here. We know this physiologically. So why aren't we using this path of co-management? And this is the future of medicine, right? We have to understand that not everything, just because it's surgical or an emergency, we're very proactive in referring for that. But let's start referring for things that are helping the patient modify their lifestyle factors, right? Looking at it differently now versus like the referrals just because there's something emergent that needs to be addressed.
Such a great point. Yeah. And again, like there's lots of collaborations I see between sleep clinics and dentists because of oral appliances for apnea. But the eye sleep connection, like you said, retinal ganglion cells, like that's what regulates the circadian rhythm, the sleep wake cycle. We talked about blue light. So there is that direct relationship there. If people want to work with you, if they want to become a patient, where can they find you? Where can people find you online?
That's a great question. My practice name is Integrative Vision. We're in Shrewsbury, New Jersey. It's integrativevision.com. We also have Instagram with the same name, Integrative Vision. If you want to request yourself as a patient, we do see patients in person, and I also do virtual consults for ocular nutrition and functional medicine, so you don't have to be in the state. And for my professionals, I have drnedagioia.com. And you can find me as well on Instagram with the same name, and LinkedIn. I'm very proactive. And I served as the president for the Ocular Wellness and Nutrition Society for 2 years. That website also has practitioners that are more proactive in nutrition and functional medicine. You can find a provider on their website. It's the ocularnutritionsociety.org. It's a nonprofit that I helped run for 2 years. I hope I help somebody connect with an eye doctor out there that's willing to work with them at this level.
Excellent. Thank you for sharing all of that. I'll put all of those links in the video description underneath this video so people go check them out. And great to know that you do the ocular nutrition consults. Likely be referring people your way. I have a few people in mind. I think that's such a great service. And like I said, I've not seen that anywhere else. So super rare. So thank you so much, Dr. Gioia.
I think this is the spark that we're going to continue this type of collaboration in the future with these subspecialties.